Hey everyone, and welcome back for another deep dive. Today, we're going to be talking about something that a lot of parents deal with, but might not always feel super comfortable discussing,
hmm
bedwetting.
hmm
You know, those nighttime accidents, the frustration of laundry, and all the ways parents can best support their kids through it.
Yeah, it's definitely something that a lot of families experience, but it's not always easy to talk about.
Right.
But it is important to remember that bedwetting, or what we call primary nocturnal enuresis in the medical world,
Primary nocturnal
this
enuresis.
is a normal part of development for a lot of kids.
Okay, primary nocturnal enuresis. Sounds pretty serious. What exactly does that mean?
Well, it's actually a very specific term. Primary means the child has never had consistent nighttime bladder control.
Okay.
And nocturnal enuresis simply means involuntary urination during sleep.
So basically peeing in their sleep.
Exactly, and this generally applies to children over 5 years old.
Oh, okay.
And we usually only consider it clinically significant if it happens more than twice a week.
Twice a week, I have to admit, even though I know it's common, those numbers still surprise me. We're talking about millions of families dealing with this.
You're right.
Something like 15 to 20% of 5-year-olds, is that right?
You got it. And the thing is, it can even persist into adolescence for some children.
Wow, that's a lot longer than I would have thought.
It is, but thankfully, around 14% of children with bedwetting see improvement each year. Most eventually gain full bladder control as they grow.
That's good to hear.
Yeah.
So it's not necessarily a quick fix, but
Yeah.
there is light at the end of the tunnel. What I found really interesting was just how much misinformation is out there about all this. You know, there are some pretty persistent myths about bedwetting.
Definitely. One of the biggest ones is that bedwetting is a behavioral issue, like the child is just being lazy or defiant. But as you delve deeper into the research, you realize that's simply not the case.
Yeah, and it can have such a huge impact on a child emotionally.
Yeah.
I was reading in one study that children rated bedwetting as extremely important in their lives, with only parental fights and divorce being more significant.
Wow. Absolutely. It really highlights the emotional weight this issue carries. It's not something children are doing intentionally, and it can lead to feelings of shame and embarrassment. It's crucial to understand the root causes, which often lie in the complex development of bladder control and the communication between the brain and the bladder, particularly during sleep.
So it's not just a matter of willpower. It's really about the body system still coming online.
hmm
And just like kids develop at different paces physically, it sounds like this too is a very individual process.
Exactly. Some children might take longer to develop those neurological pathways that signal a full bladder during sleep.
So we've established that it's not about a child being lazy, it's more about their bodies catching up. What are some other factors that might contribute to bedwetting?
Well, genetics plays a huge role. If one parent wet the bed as a child, the chances of their child also experiencing it go up significantly.
How much are we talking about?
If both parents were bedwetters, the likelihood jumps to 70 to 80%.
Wow, that's a pretty big jump.
Okay.
So family history is a factor. What else?
Another one is bladder capacity. Some children just might simply have smaller bladders that haven't grown enough to hold an entire night's worth of urine.
So it really is a purely physical development issue, not just about brain signaling.
Right.
Are there any other physiological factors at play?
Absolutely. Hormones also come into play. You've probably heard of antidiuretic hormone, or ADH.
I have, but to be honest, I don't fully understand what it does.
Well, ADH is crucial for regulating urine production, especially at night. It acts like a signal telling your kidneys to slow down urine production, giving your bladder a break overnight. Some children might not produce enough ADH at night, which can lead to a fuller bladder than they can handle while they're sleeping.
So it's like their internal plumbing system is working overtime. And some kids, I imagine, might just sleep so soundly that they don't wake up even when their bladder's full.
You're exactly right. Deep sleep patterns can definitely be a factor, making them less sensitive to those signals from their bladder.
Okay, this is all starting to make a lot more sense. So we've covered a lot of ground here, from the medical definition to the various causes of bedwetting. But at what point should a parent consider getting professional help?
It's a great question, and it's one that a lot of parents struggle with. While most children will eventually outgrow bedwetting on their own, there are definitely some red flags to watch out for. If your child is 7 years old or older and is still wetting the bed frequently, it's definitely time to talk to your doctor.
7 years old. Got it. So not necessarily a cause for concern right away, but if it's persisting past that age, it might be time to get some expert advice. Are there any other signs that professional evaluation might be needed?
Absolutely. If your child is extremely distressed or embarrassed by the bedwetting, or if you notice any additional symptoms, it's important to seek help. Things like daytime wetting, painful urination constipation, or blood in the urine should never be ignored.
They sound a lot more serious.
They can be. And it's also worth checking with your doctor if bedwetting starts suddenly after a period of being dry. This could potentially point to an underlying medical issue, like a urinary tract infection, diabetes, or even constipation, which we don't always think of as being connected.
It's amazing how interconnected our bodies are. So it's not just about the bedwetting itself, but also about the context and any accompanying symptoms.
Precisely. Even if there isn't an underlying medical condition, seeking professional help can be incredibly reassuring for both you and your child. A healthcare professional can help rule out any concerns, offer advice on management techniques, and even explore treatment options if needed. It's about feeling empowered and having a plan, not just waiting it out and hoping for the best.
That's a great point. So even if it's just to get some peace of mind, a doctor's visit can be really helpful. Now, I know there's a lot that parents can do at home to help manage bedwetting, even while waiting for an appointment. Let's dive into some practical tips.
Let's do it. One of the most important things is managing fluid intake. Encourage your child to drink plenty of fluids throughout the day, but start limiting their intake in the evening, especially in the 2 hours leading up to bedtime.
That makes a lot of sense. It's about preventing an overly full bladder during the night, right?
Exactly. And it's also helpful to avoid bladder irritants, especially before bed. Things like caffeine, carbonated drinks, citrus fruits, and even chocolate can irritate the bladder and increase urine production.
Okay, so those are off the menu in the evenings. What else can parents do?
Another simple but effective tip is gulp voiding before bed. Have your child urinate twice with a 10-minute gap between to ensure that the bladder is as empty as possible.
That's a great tip. I never would have thought of that. And what about daytime bathroom habits? Is there anything parents can do to encourage good habits during the day?
Absolutely. Establishing regular toilet breaks throughout the day, ideally every 2 hours, can help to create a healthy voiding pattern. And believe it or not, addressing constipation can also make a big difference.
Constipation. How does that tie into bedwetting?
Well, a full bowel can actually press on the bladder, reducing its capacity, so ensuring regular bowel movements can really help with nighttime bladder control.
It's amazing how everything is connected. So managing fluid intake, double voiding, and addressing constipation are all really important. But what about the emotional side of things? How can parents best support their children emotionally through this?
That's a crucial aspect that we definitely need to address.
Great. So let's pause there and pick up the conversation on emotional support and more practical tips right after this short break. Welcome back. We're continuing our deep dive on bedwetting. And we were just getting into the emotional side of things and, how parents can provide the best support for their kids. It's easy to get caught up in, the practicalities of it all. But it's so important to remember that emotional impact this can have.
Absolutely. We've talked about the physiological factors, but the emotional piece is just as critical.
Hmm.
Children who wet the bed often experience feelings of shame, embarrassment, and even anxiety, especially as they get older.
And as we heard earlier, some studies even suggest that children rate bedwetting as a major life stressor, right up there with parental conflicts. That's really powerful.
It is. It really highlights, the emotional weight this issue carries. It's not something children are doing intentionally, and it can lead to, feelings of shame and embarrassment. It's crucial to understand those root causes, which often lie in the complex development of bladder control and the communication between the brain and the bladder, particularly during sleep.
Hmm. So how can parents approach this topic in a way that's sensitive and supportive?
Well, it starts with open communication and creating a safe space for your child to share their feelings without fear of judgment. It's important to let them know that you understand bedwetting is not their fault and that they're not alone in experiencing this.
That makes sense. It's about validating their feelings and helping them understand that they're not, broken or different because of this.
Precisely. Sometimes just acknowledging their emotions and offering reassurance can make a world of difference. It's also important to approach this as a team effort. Instead of dictating rules and strategies, try to involve your child in finding solutions.
I love that idea. It's about empowering them to take ownership of the situation, even if it's something, as simple as choosing a waterproof mattress protector they like or picking out bedtime stories while practicing limiting fluids.
Exactly. Those little things can really shift their perspective and make them feel more in control.
Now, I've heard a lot about star charts and reward systems for bedwetting. What's your take on those? Can they be helpful or do they sometimes backfire?
It's a tricky one. The intention behind them is good. It's all about positive reinforcement. But when it comes to bedwetting, they can sometimes have unintended negative consequences.
Really? Why is that?
Well, as we've discussed, bedwetting isn't something a child can consciously control. They're already trying their best, and if they consistently don't earn those stars or rewards, it can reinforce feelings of failure even though they're putting in the effort.
That makes a lot of sense. It's like adding another layer of pressure to something that's already causing them stress. And I imagine it can also be confusing for them if they're doing all the right things but still having accidents.
Absolutely. It can send the message that they're not doing enough, which can be really damaging to their self-esteem, especially if they're already comparing themselves to friends or siblings who don't wet the bed.
So what's the alternative? How can parents encourage progress without making it feel like a pass or fail situation?
It's about shifting the focus from outcomes to effort and progress. Celebrate small victories like having a dry night after trying a new strategy or managing to stay dry for a longer stretch than usual, even if an accident still happened. It's about acknowledging their effort and helping them build confidence.
That's a great point. Small wins can be really powerful motivators, especially for kids. Now, another thing that came up in our research was this idea of cleanliness training. It sounds a bit controversial, but I'm curious to hear your thoughts on it.
It's definitely a sensitive topic and requires a nuanced approach. The intention behind cleanliness training isn't to punish or shame a child, but rather to help them understand the consequences of bedwetting and take responsibility for cleaning up in an age-appropriate way.
So it's not about making them feel bad, but about giving them a sense of agency and control over the situation.
Exactly. Involving your child in changing the sheets and cleaning up again in a way that's appropriate for their age can help them feel more in control rather than feeling helpless or punished for something they couldn't help.
It's like turning it into a learning experience, not a punishment.
Mm.
I imagine it's important to tailor the approach based on the child's maturity level.
Mm-hmm.
What might that look like in practice?
Absolutely. For a younger child, it might be as simple as helping to put the wet sheets in the laundry basket. For an older child, they might be able to change the sheets themselves. The key is to make it a collaborative effort, not a disciplinary action.
And that brings us to this crucial link between bedwetting and sleep. We touched on this earlier, but I think it deserves a bit more attention. After all, a well-rested child is a happier, healthier child, right?
Absolutely. And it's not just about achieving dryness, it's about supporting your child's overall well-being. Healthy sleep is a huge part of that equation.
One of the things that fascinated me in our research was this delicate balance between managing bedwetting and protecting those healthy sleep patterns. It seems like there's a lot to consider.
There certainly is. Some parents, for example, try waking their child up during the night to go to the bathroom, thinking it will prevent accidents. However, this can actually disrupt their sleep cycle and potentially worsen bedwetting in the long run.
That seems so counterintuitive.
Yeah.
I can see why parents might think that's helpful,
Yeah.
but it sounds like it could really backfire.
Exactly. It's important to remember that sleep is when our bodies and brains do essential restorative work, and interrupting that process can have unintended consequences. Even if a child manages to stay dry because they were woken up, their overall sleep quality might suffer.
So we don't want to sacrifice sleep quality in the pursuit of dryness. But then what's the alternative? Do we just let them sleep through the night and deal with the wet sheets in the morning?
It's about finding a balance. One technique some doctors suggest is called lifting.
Lifting, what's that?
It involves gently picking up your child an hour or so after they've fallen asleep and taking them to the toilet to empty their bladder. The key is to do this without fully waking them up.
So it's almost like sleepwalking to the bathroom.
In a way, yes. The idea is to minimize sleep disruption while still helping to empty their bladder and potentially preventing accidents. Of course, this technique might not work for every child, and it's important to discuss it with your child's doctor to see if it's appropriate.
That's a really interesting technique. I
Yeah.
can see how it could be helpful for some kids. But as with everything else we've discussed, it sounds like finding that right balance between managing bedwetting and promoting healthy sleep is a very individualized process.
That's exactly right. There's no one-size-fits-all solution. It's about being patient, being observant, and working with a healthcare professional to find the strategies that best support your child's overall well-being.
It's a great reminder that each child is unique, and what works for one might not work for another. We've talked a lot about what parents can do, but what about siblings? Bedwetting doesn't just impact the child experiencing it. It can affect the whole family dynamic.
You're absolutely right. Siblings can play an important role, too. In fact, one guide we looked at for parents specifically mentioned establishing a no teasing rule in the household.
I love that. It can be so tempting for siblings to tease or make fun of a child who wets the bed, but obviously that can have a devastating impact on their self-esteem.
It can also create tension and resentment within the family, which is the last thing anyone needs when dealing with a sensitive issue like this.
So how can parents help siblings understand and support their brother or sister who's experiencing bedwetting?
I think open communication is key, just like with the child who's wetting the bed. Explain to siblings in an age-appropriate way what bedwetting is and why it happens. Help them understand that it's not something their brother or sister is choosing to do, and that it's something they'll eventually grow out of.
And instead of feeling like it's a secret or something to be ashamed of, involving siblings and finding solutions and creating a supportive environment can be incredibly helpful. Maybe they can help choose a special reward for dry nights, something the whole family can enjoy together, or even join in on some of the strategies like limiting fluids before bedtime to show solidarity and make it a family effort.
Those are all fantastic ideas.
Yeah.
It's really about fostering empathy and understanding within the family. It's about creating a safe and supportive space where everyone feels heard and respected, and where bedwetting is treated as a challenge to overcome together, not a source of shame or ridicule.
This has been such a rich and insightful discussion. We've covered so much ground, from the science behind bedwetting to practical tips to understanding that emotional and psychological impact. I'm feeling much more equipped to support my own child, and I'm sure our listeners are too. But before we wrap up this part of our deep dive, I'd love to hear your final thoughts on the link between bedwetting and stress. It's something that came up in several of our sources, and I think it's an important element to address.
You're absolutely right. While stress doesn't directly cause bedwetting in most cases, it can definitely be a contributing factor, and it can also be a consequence of the bedwetting itself. It can create a sort of vicious cycle.
Now that makes sense. The bedwetting can cause stress, and then the stress can worsen the bedwetting. It's a tricky situation for everyone involved.
Exactly. Children who wet the bed might experience anxiety about sleepovers, social events, or even just going to bed at night. This anxiety can lead to increased muscle tension, which can make it harder to fully relax and empty their bladder. And of course, the more they worry about wetting the bed, the more likely it is to happen.
So what can parents do to help break this cycle? How do we address the stress and anxiety that often accompanies bedwetting?
That's what we'll explore when we come back after a short break.
Welcome back to our deep dive on bedwetting. We've been talking about the link between bedwetting and stress and how it can sometimes create a bit of a vicious cycle. How can parents help their kids manage those stressful feelings?
Well, the first step is recognizing and acknowledging the stress. If your child is experiencing anxiety related to bedwetting, let them know that their feelings are valid, talk to them about their worries, and work together to develop coping mechanisms.
What are some examples of coping mechanisms that parents can teach their children?
Oh, there are a lot of great options. Simple things like deep breathing exercises, progressive muscle relaxation, or even just establishing a calming bedtime routine can be incredibly helpful in reducing stress and promoting relaxation.
So it's about giving them tools to manage those feelings of anxiety.
Exactly. And if the anxiety is severe or persistent, it might be beneficial to seek professional help from a therapist or counselor who specializes in childhood anxiety. Sometimes having that extra support and guidance can make a world of difference.
That makes sense. And it's important to remember that addressing stress isn't just about managing bedwetting. It's really about supporting your child's overall mental and emotional well-being, which is so crucial for their development in all areas of life.
Absolutely. You know, helping your child develop healthy coping skills for stress and anxiety will benefit them far beyond this specific situation. It's about equipping them with tools they can use throughout their lives.
You know, as we've been talking about all this, something else has been on my mind. We've touched on the impact of bedwetting on self-esteem, but I think it's also important to recognize how it can affect a child's sense of autonomy and independence.
Yeah, that's such a great point. It's something we often overlook. Children are constantly striving for more independence, and bedwetting can feel like a step backwards in that journey.
Exactly. It can make them feel like they're still a baby because they need help with something that their friends or siblings can do on their own. That can be really frustrating for them, especially as they get older.
And that feeling of dependence can be particularly challenging for older children who are already navigating social pressures and comparing themselves to their peers. It can really impact their confidence and make them reluctant to participate in activities that they would otherwise enjoy.
So knowing that, how can we as parents help our children maintain a sense of autonomy while they're working through this challenge?
I think it's about finding ways to empower them within the context of their bedwetting experience. You know, give them choices whenever possible. Let them choose their own bedwetting alarm, pick out special pajamas that make them feel good, or even be involved in deciding, on which strategies to try.
It's about making them feel like active participants in the process, not passive recipients of rules and decisions.
Exactly, and celebrate their efforts and progress no matter how small. Acknowledge that they're working hard to overcome this challenge and that you're proud of their dedication.
It's about focusing on their strengths and their resilience, not just on the bedwetting itself.
Absolutely.
Yeah.
It's about sending the message that they are capable, they are loved, and that they will get through this.
This has been such a valuable conversation. We've
Mm.
covered so much ground, and I feel like I've gained a whole new understanding of bedwetting. It's clear that it's a complex issue with both physical and emotional dimensions, and it's something that, a lot of families face. But I think the most important takeaway for me is that there's hope, there's help, and with the right support, children can overcome this challenge and thrive.
Yeah, I couldn't agree more. Bedwetting can be a journey, but it's a journey that you and your child can navigate together. Remember, you're not alone. There's plenty of help available, and with the right support, your child can achieve those dry nights and reclaim that sense of independence they crave.
Okay, so what does this all mean for you, our listeners? If your child is experiencing bedwetting, remember that it's common, it's often temporary, and it's not a reflection of your parenting or your child's worth. Be patient, be supportive, and seek help if you need it. With the right approach, you and your child can work through this together.
And remember, knowledge is power. The more you understand about bedwetting, the better equipped you'll be to support your child.
Thanks for joining us on this deep dive. We'll be back with another fascinating topic soon. Until then, keep those questions coming and keep diving deep.